Welcome everyone, thanks for coming out on such a cold, dark night. So as David mentioned, tonight I'm going to be addressing the question, is vitamin C simply snake oil or is it really a valid therapy for infection? So what is snake oil? Snake oil is a substance with no real value sold as a remedy for all diseases. So in the past, vitamin C has been portrayed as a bit of a cure-all, kind of like snake oil, and so as a result of that it's kind of become quite a controversial topic, particularly in the medical arena. So what Gabi and I are going to do tonight is talk to you about the science behind the use of vitamin C in infection and cancer. So most animals can make their own vitamin C, and so that kind of means that it's not really a vitamin for them, because vitamins are something that you can't make yourself, and so you have to obtain it through the diet. However, there are a few animal species, only a handful, that can't make their own vitamin C, and humans are one of those species. So why can't we make our own vitamin C? Normally, vitamin C is synthesised from glucose in plants and the livers of most animals, but humans are lacking one of the key enzymes in the biosynthetic pathway, and this is due to mutations in this enzyme, and so it means we cannot synthesise our own vitamin C, and so we must obtain it through the diet, and it primarily comes from fresh fruit and vegetables. If we don't get enough vitamin C in the diet, this results in the potentially fatal deficiency disease scurvy. And I think most of you are probably aware that scurvy used to be quite common in long sailing voyages, and this was due to the lack of fresh fruit and vegetables. So the signs and symptoms of scurvy are relatively mild to begin with, and they include general malaise, lethargy and emotional changes. And these can progress to bleeding gums, loss of teeth, skin bruising, which is shown here, poor wound healing, bone and muscle pain, and eventually death. So it's not a very pleasant disease overall, and it's still found today even in Western societies. So the dietary vitamin C is absorbed through the small intestines through specialised vitamin C transporters, and these maintain our blood levels at about 50 to 70 micromolar, which are considered adequate to optimal levels. The kidneys can also reabsorb vitamin C from the urine, and so this helps maintain the plasma levels at 50 to 70 micromolar. But because vitamin C is water soluble, any excess that your body doesn't need is excreted by the kidneys. So this figure shows what happens in our blood when we eat vitamin C. So you can see that vitamin C levels peak about 2 to 3 hours after we eat our meal, but then they come back down to baseline levels, and this is because the kidneys are clearing any excess that the body doesn't need. So what this means is if you want to maintain your vitamin C levels at optimal, you should really take it several times throughout the day, not just a one-off dose. So although plasma levels are maintained at about 50 to 70 micromolar, there are certain glands and organs that accumulate vitamin C at much higher levels, such as the brain, adrenals and pituitary. And so this suggests that, that vitamin C has very important functions in these organs. Vitamin C has a number of important functions in the body. It is a cofactor for a family of enzymes, and these enzymes have numerous regulatory and biosynthetic roles in the body. For example, vitamin C is required for collagen synthesis, and collagen is what gives skin and tendons its strength and flexibility. It's also required for mitochondrial energy production, and mitochondria are the little powerhouses we have inside each cell, and vitamin C is required for the synthesis of the compound that actually carries fats into the mitochondria for burning, for energy. Vitamin C is also required for hormone and neurotransmitter synthesis and metabolic regulation through control of proteins that regulate genes. And recent research has also shown that vitamin C is involved in epigenetic regulation through modification of DNA and histones. And histones are the proteins that DNA is actually wrapped around in order to help it package inside the cells, and they can also regulate what genes are expressed. So all these varied functions of vitamin C in the body mean that it's very important that we maintain an adequate and regular intake of the vitamin. But something we need to be aware of is that not all foods are created equal when it comes to their vitamin C content. Most of us are aware that citrus fruits such as oranges and lemons are quite high in vitamin C, but other commonly consumed foods such as bananas and apples are actually quite low in vitamin C. Kiwi fruit are a really good source of vitamin C. They have 2 to 3 times as much vitamin C as oranges, and so that's why we usually use kiwi fruit in our human intervention studies. So one question that people often ask is, which is better, getting my vitamin C from food or a tablet's okay? And this is because foods contain other compounds such as bioflavonoids, which are potent antioxidants that could potentially protect vitamin C from being oxidised and thereby increase its uptake into the body. So what we did was we carried out a couple of human intervention studies to test whether vitamin C uptake is better from food, and we used kiwi fruit in this case, or from tablets. And what we found was that there was no difference between uptake of kiwi fruit-derived vitamin C and vitamin C from tablets. So what this means is that other components in the food are neither enhancing nor inhibiting the uptake of vitamin C from the food, but we still recommend that you get your vitamin C from the whole food because of all the other important vitamins and minerals in the food. So how much vitamin C do we actually need? So I've created this version, my own version of a traffic light to kind of highlight the main categories. So dietary intakes of 200 milligrams a day will give blood levels of about 70 micromolar, which are considered saturating. And what that means is that if you have more than this, your body will excrete any that it doesn't need. Intakes of 100 milligrams a day, which is about the average New Zealand intake, will provide levels less than 50 micromolar, and that's considered inadequate. Blood levels of less than 23 micromolar are considered marginal and they're prone to becoming deficient, and levels less than 11 micromolar deficient and prone to developing scurvy. So the New Zealand Ministry of Health has a suggested dietary target for the reduction of chronic disease risk being 200 milligrams a day. And this can be obtained from a diet of 5 to 7 servings of fresh fruit and veggies a day, but as long as you have some high vitamin C foods such as kiwi fruit in that quota. This figure shows that there are a number of diseases that can be partially or almost fully avoided by healthy diet and lifestyle choices. So some of you may recall the old food pyramid, which used to have grains as the largest food group. However, the US government now recommends that half your plate should be fruit and vegetables, only a quarter grains and a quarter protein. So next time you're eating a meal, have a look at your plate and see if half of it is fruit and vegetables. And it can actually be quite challenging to eat that many fruit and veggies with every meal, but it's definitely worth it if you want to maintain your health, and particularly if you want to get your vitamin C, adequate vitamin C levels. And remember not to overcook your veggies because you lose a lot of your vitamin C that way. So before I finish this section of my talk, I thought I'd just briefly talk about the international recommended dietary intakes for vitamin C. So when I was doing my postdoctoral research in the States, I published an extensive review on the antioxidant and health effects of vitamin C in humans. And from this evidence base, we recommended a 2-fold increase in the US RDI for vitamin C. And this report was submitted to the US Food and Nutrition Board of the Institutes of Medicine during their review of the RDIs for the antioxidant vitamins. And the RDI for vitamin C, the US RDI, was subsequently increased 1.5-fold from 60 to 90 milligrams a day, which provides closer to adequate levels. And I'd like to see something similar happen in New Zealand because you can see that we currently have one of the lowest RDIs of vitamin C in the world. And that's because the New Zealand RDI is based on prevention of scurvy, not on the health, rather than the health effects of vitamin C. And it doesn't give anywhere near what we'd consider high enough levels for optimal health. And it's interesting to note that animals which can synthesise their own vitamin C always maintain their levels at saturating. And furthermore, if they become stressed or diseased or are administered drugs, they actually increase their levels of their vitamin C synthesis to compensate. And I'll come back to that point later. So I'm just going to change tact a little bit and introduce you to vitamin C advocate Linus Pauling. So Linus Pauling's perhaps best known for being the only person to have been awarded 2 unshared Nobel Prizes. one in chemistry in 1954 for his work on the nature of the chemical bond, and a Peace Prize in 1962 for his anti-nuclear campaigning. So it was really Linus Pauling who popularised the use of vitamin C for infections such as the common cold. In the 1970s, he published a popular book called Vitamin C and the Common Cold. And you can see that not long after he published his book, there was an upsurge in clinical trials looking at the use of vitamin C for the common cold. So a Cochrane review has been published looking at all the studies that investigated vitamin C for preventing and treating the common cold. And a handful of studies have shown that vitamin C can reduce the risk of getting a cold, but only if you're under some sort of stress like cold temperatures or physical stress. Numerous other studies have shown that if you have a regular intake of vitamin C, it can decrease the severity of the symptoms and also the duration of the infection. And my husband tells me that when he was a kid playing rugby out in the cold and wet, they used to always have orange smiles at half time. And I wonder if, I have a feeling that probably prevented a lot of children from coming down with colds. And I'm not sure if that's still done these days, but hopefully it is. So a common cold can go on to develop into a severe respiratory infection, such as pneumonia, and pneumonia can go on to result in a condition known as sepsis. And sepsis is defined as an uncontrolled response, inflammatory response to infection. And severe sepsis is when the organs start shutting down and the person has to be admitted to the intensive care unit. And septic shock is when that person develops seriously low blood pressure that's not responsive to fluid resuscitation or vasopressor drugs such as adrenaline, and it is a major cause of death in critically ill people. This figure shows vitamin C levels in different diseases, including severe infection. And you can see that patients with pneumonia have inadequate levels of vitamin C, and if they go on to develop sepsis and end up in the ICU, they have the lowest levels of all patients. Cancer patients tend to have vitamin C levels that are close to that marginal cutoff, and Gabi will talk more about that in her presentation. So vitamin C is not routinely measured in hospital settings, and there's a number of reasons for that, such as the requirement for specialised equipment and also a general lack of understanding by clinicians around the role and importance of adequate amounts of vitamin C in the body. We measure vitamin C in our laboratory using high-performance liquid chromatography with electrochemical detection, and that's the gold standard method for measuring vitamin C in biological samples. And what this machine does is it separates out the relevant compounds in the blood so that we can measure their levels. And the blood samples that we have to take have to be handled and processed very carefully because the vitamin C is very unstable once it's removed from the body, and it can readily break down. So we've measured vitamin C levels of patients with sepsis here in Christchurch Hospital. This figure shows vitamin C levels of 2 community dwelling cohorts, young adults and middle-aged people, and vitamin C levels in 2 patient cohorts, patients with sepsis in the hospital wards and patients with severe sepsis in the intensive care unit. And you can see that the 2 patient cohorts have vitamin C levels that are significantly less than the 2 community dwelling cohorts. Furthermore, you can see that a much higher percentage of the patients have marginal and deficient vitamin C levels than the other 2 cohorts. So vitamin C deficiency seems to be a real issue in hospital settings. And I don't think hospital food helps very much because there's very little, if any, vitamin C in hospital food. So if you know anyone in hospital, take them kiwi fruit rather than flowers, and their bodies will thank you. So when patients are in the ICU, they're usually kept sedated because they're often being mechanically ventilated. And so what this means is that they can't eat, and so liquid nutrition has to be provided to them by a couple of different methods. The most common method is to drip feed it directly into the stomach through a nasogastric tube. And the other method is to inject it into the circulation through a central line. And these methods will provide vitamin C at levels of 100 to 250 milligrams a day. So what we did was we worked out how much a patient's vitamin C levels should be based on how much vitamin C they've been given in their nutrition, and that's shown by the green bar here. And we compared this with how much vitamin C we actually measured in their blood, which is shown by the orange bar. So you can see their vitamin C levels are nowhere near what they should be, despite getting recommended intakes. So this suggests that critically ill patients need much more vitamin C than is provided in their liquid nutrition in hospital. The concept that vitamin C requirements are higher in critically ill patients is not new. In this study by Long et al. In 2003, increasing doses of vitamin C were given to critically ill patients in their intravenous nutrition. And you can see that doses of 1,000 milligrams a day still weren't enough to get their levels above that 23 micromolar marginal cutoff. Doses of 3,000 milligrams a day did eventually result in saturating levels. But this means that doses that are more than enough for healthy people, you and I, are nowhere near enough for these critically ill patients. And you might recall me mentioning that animals that can synthesise their own vitamin C actually increase their synthesis of the vitamin C if they become stressed, diseased, or are administered drugs. So does this remind anyone of ICU patients? They're physiologically stressed, they're often under a disease burden, they're being administered heaps of drugs, so it's not surprising that they have higher requirements than the average person. So over the last few years we've had examples in the media of patients with acute lung infections who are so ill that they were about to have their life support turned off until their families insisted on intravenous vitamin C, after which the patients made miraculous recoveries. So there's been a Cochrane review published on studies that have looked at vitamin C for preventing and treating pneumonia. A few studies have shown that vitamin C reduces the risk of getting pneumonia, and a couple of other studies have shown that it decreases the severity of the respiratory systems and also the duration of the disease. So these chest x-rays are of a patient who came down with an acute lung infection, and that's shown by the cloudiness in their lungs. And you can see that their lungs are still cloudy nearly 3 weeks later. So these images are from a colleague of mine in the States, and I think this patient actually ended up in a nursing home following this infectious episode because they were no longer able to look after themselves. In contrast, this patient received intravenous vitamin C for their lung infection. So the vitamin C was started on infusions, was started on day 2, and by day 4 you can see a dramatic clearance in the patient's lungs, and these continued to improve over the next few days. So quite different to the previous patient who didn't receive any vitamin C. And so a long-term goal of ours is to be able to administer vitamin C to patients with pneumonia in the hospital wards to prevent them going on to develop sepsis, and so that they don't then have to move through into the ICU. So another dramatic finding is that administration of 6 to 7 grams a day to critically ill patients with sepsis can dramatically reduce the number of patients dying by 80%. And this is a huge decrease in death rates. And so more and more evidence is accumulating that vitamin C could be very beneficial for critically ill patients, and maybe we can even save lives with vitamin C. And it's interesting to note that this ICU in this clinical ICU in the States is actually now routinely administering vitamin C to all their septic patients. And I'd like to see something similar happen to ICUs in New Zealand. And to that end, we're currently trying to set up a vitamin C intervention study here in the Christchurch Hospital ICU. And so I have a very simple take-home message tonight. If you are a happy, healthy character like SpongeBob who eats lots of fruit and vegetables, you'll be saturated with vitamin C, and adding more vitamin C to a wet sponge will not make it any wetter. However, if you're a dried out sponge due to either not eating enough vitamin C or because you have an illness such as an infection, your body will be craving vitamin C, and it will absorb any that you add, and eventually you will become saturated, but only if it's added in sufficient amounts. So I thank you for your attention, and I thank the HRC and the Canterbury Medical Research Foundation for their sponsorship as well. And we'll take questions at the end.
Hello there. So I'm going to follow up from Anitra, who's been talking about infectious diseases and such likes, and I'll be talking a bit more about cancer. Just a quick introduction for myself. As you can probably tell within the first 3 seconds that I'm not a Kiwi. I was born in Namibia, which at that point was called Southwest Africa. But I have been in this country now for 14 years, so I'm getting the hang of how it works here in New Zealand. So to start with, I'm going to introduce to you what is cancer, because not everybody actually has a good understanding of what's involved in this disease. So it starts off as a series of mutations, and they then result in a cancer cell that's transformed. And those cancer cells will grow into a malignant tumor. The important thing is that not all cancers are the same. So a breast cancer is not the same as a kidney cancer, is not the same as a brain cancer. And they get treated very differently. And they are actually really different diseases. And that's why the battle against cancer is so, so difficult, because it is not one disease. So what is the sort of characteristic that goes across all types of cancer? And I'm going to go through what's called the hallmarks of cancer. So they all show uncontrolled cell growth. They all show a level of genetic instability, which means once a cancer cell has done the transformation, they can undergo further genetic changes, which makes them even more aggressive. Most of them are resistant to therapy after some time, and that therapy can be chemotherapy, radiation. In order to grow from a size of like a pinhead of a needle to anything bigger than that, the tumor has to call in its own vasculature in order to grow any bigger. Otherwise, they stay as these tiny little nodules that don't do anything. Most tumors rely heavily on glucose, on sugar, for their survival, and they have a different kind of metabolism from a lot of other types of cells. What's the most important thing really with cancer is that they invade other organs. They don't stay put and just grow into a big lump. They start invading elsewhere, and that is what makes a tumor so dangerous and so lethal. And that is called metastasis. And more recently, there's been a lot of attention in the literature and in the media about the immune system. And tumors are really good at preventing the immune system from recognizing them. And they have a way of defending themselves against the immune system. So these are all hallmarks of cancer. Now I'm going to go on to a protein that I've been passionately investigating for the last 25 years. And I'll call him here the master regulator. Its proper name is HIF. Now, to understand how HIF is involved in these hallmarks of cancer, I'll bring up more or less the same picture again. And as you can see from here, HIF has a vital role to play in the growth of the tumor, the resistance to therapy, the growth of the blood vessels, its ability to grow on glucose, its ability to spread and to evade the immune system. But I can see that having a molecular factor like that doesn't really make it visible as to what its role really is in cancer. So I've given it a character, and I'm calling him Al. So he's the mafia boss, and he controls all these other systems, but he doesn't get his hands dirty, really. He is just the one that's controlling all these systems. So what we are trying to do in our work is to get this mafioso under control, put him behind bars. So we're obviously not the only people that have thought of this, and HIF is a target for the development of new cancer drugs worldwide. And a recent survey showed 41 new patents that are looking into how can we regulate HIF as this master regulator. Now, same as the mafia, he's not the only kingpin. But if we can get him under control, a lot of things will become more normalized in the tumor. And what this talk is going to be about is whether we think that vitamin C can possibly fulfill the role of the jailer of this very important factor called HIF. So this is a brief and very condensed history of where vitamin C and cancer come from. Anitra has already talked about Linus Pauling and his work in infectious diseases. He also was starting work in cancer. And an important paper of his was published in the mid-70s, where they had a reasonable-sized cohort of very late-stage cancer patients, and they gave them both oral and injected vitamin C. And they then found that those patients survived for longer than an unrelated cohort, a historical cohort, that was not treated. Now, for modern medicine, that was not a good trial because we don't know exactly what the condition was of the patients that were treated in his trial versus the ones that he compared it to. So a big clinical trial was carried out in the Mayo Clinic in America, and they did a very controlled trial where they had patients side by side that were treated with vitamin C and those that were not treated with vitamin C. The main thing here is that those patients only received oral vitamin C, and that is an important difference because at this point in the late 70s, early 80s, vitamin C, as far as cancer goes, was dead. It was dead and buried. It was proven to be ineffectual. However, about 20 years later, another study found that actually the levels that you can achieve in the blood circulating when vitamin C is injected versus taken in orally is vastly different. And that might explain some of the differences that were observed between these two patient trials. Also in the early 2000s, new roles of vitamin C were identified, and Anitra pointed at some of them, specifically its role as a cofactor for a huge family of enzymes. We were then the first ones to measure the amount of vitamin C that actually is inside a tumor in 2010. And there are ongoing small clinical trials worldwide, none of them with enough power to give us confidence whether or not vitamin C is functioning as a cancer treatment or not. But what we're doing is we're just starting to measure things and to check what actually happens in cancer patients. So this is a graph showing the difference that in vitamin C levels that are obtainable giving vitamin C orally, which is in that pink area, versus if vitamin C is injected. And there's about a 200-fold difference in the concentration that can be reached in the blood. As it also shows here, it's a very short term that the vitamin C is that high when it's injected. So that is also an important issue that we need to keep in mind. So we've done several small studies here just to look at the vitamin C intake in people with cancer and without cancer. So this was done using a survey. So people were asked, what did you eat over the last 24 hours? Because thinking further back, often the memory gets a bit hazy. So from that, we then could calculate, say they had an egg and a toast for breakfast and an orange at lunchtime. We could calculate from there how much vitamin C intake they had. And what I've done here is I've separated them into a similar sort of color coding as Anitra, showing marginal to deficient in the red versus the green, which is saturating levels of intake. And we found that between just under a half of the healthy adults to a little bit over half of the cancer patients that we questioned had below adequate levels of vitamin C that they were taking in. So their diet wasn't quite as good as they thought it should be. However, that is the intake. What happens when you actually measure it? So we did blood tests in healthy people, so a cohort that's similar in age to the cancer patients that we looked at. And again, the color coding here is going from saturating in green to marginal to deficient in the red. And here it is actually quite a scary picture. If you look at the amount of vitamin C in healthy adults, we're looking at about 2/3 of people. Their levels in the plasma are pretty low. They are below what's called adequate. It gets more severe in the cancer patients. So that's 3/4 of cancer patients are really not sufficient in their vitamin C levels in the plasma. What I also need to point out here are the small numbers in the cancer patients at the moment, and we are planning a much bigger trial to look at what the plasma levels are in cancer patients. And it's likely that, again, because cancer patients are under stress, their cancer is putting them under stress, that they actually require a higher intake than healthy people. So we needed to see what actually happens in the tumor. And for that, we have a marvelous local treasure called the Cancer Society Tissue Bank. At this stage, we have about 10,000 cancer patients who have donated their tissue for research. And for us as researchers, what we have to do is we have to ask for ethical approval in order to get access to these tissues, and we need to get the Cancer Society Tissue Bank board to approve the study. So it's quite a strenuous effort that you have to go to. But then we have this fabulous selection of different types of cancers. You might not be able to see all the wording done here, but we have the main cancer types. We have the bowels, the breast, the kidney, but also some less common ones like gastric or pediatric cancers. And from there, we selected 4 types of cancer to analyze in the first instance. So we looked at bowel cancer, cancer of the uterus, breast cancer, and kidney cancer. And we got about 50 patient samples. And all of these, we had the actual cancer and associated normal tissue to test. And we looked at what we could see for vitamin C in these tissues. So how do we actually measure vitamin C in a tissue as opposed to like plasma samples? So in the first instance, as I said, the tissue bank gets its sample from the surgery. So it's normal surgery that the patient undergoes. And we get a tiny little piece from the tumor that the pathologist select, which is beyond what's needed for diagnosis, because we don't want to hinder any of the diagnostic tests. So here it shows, if you look at it carefully, this is somebody's finger, and this is a plastic tube. And that tiny little spot down there is the amount of tissue that we require for our test. Is really small. That gets ground into a fine powder and a very low temperatures in order to preserve all the integrity of the tissue that we're interested in. And then we put it into like a liquid and inject it into the HPLC that Anitra had introduced you to, which is a highly specialized piece of machinery that then can analyze amount of vitamin C in the tissues. Now, what do we do in order to look at things like the HIF, the master regulator? It's pretty similar up to the point that we get the fine powder, except at that stage we can then separate it out on a protein gel and determine the amount of the protein of interest, and we can quantify these things. So what did we find in our cancer patients? So this is the vitamin C versus the master regulator. Well, the most important thing is that every time we saw high vitamin C levels within the tumor, we saw low levels of the master regulator. So it appears as if the more vitamin C is in the tumor, the more likely it is we can put the master regulator behind bars. So that is just HIF, just that protein. So what happens to the other parts of the cancer spectrum? We've got evidence to show that the proliferation, so the growth of the tumor is slowed down, that it becomes less resistant to therapies. It reduces the amount of new vessels that the tumor can form and thereby reduce its ability to grow bigger. It's no longer as reliant and able to use sugar. There's less of the spread of the tumor outside and into other organs. And we have some evidence showing that the immune system can start to see the tumor again. Some of this work is done from the cancer patients. Some of it is in other studies that we've done alongside of it. So what does it actually mean to the cancer patients? This is all nice and fine, but if you're sitting there as a patient with cancer. So this is our best result so far, which is looking in patients that had bowel cancer. So these are the 50 patients that we analyzed the vitamin C in their tumors. And if we separated that cohort of cancer patients into those that had relatively high levels of vitamin C in the tumor and those that had relatively low vitamin C in their tumor. And then they got followed over 6 years to see how they fared, what their survival was like. And this graph here shows is the proportion of the people that survived without their tumor recurring or metastasizing, so without it spreading. And we could show that the patients that had high vitamin C in their tumor lived longer without the tumor coming back versus the ones that had low vitamin C. So their tumors recurred or metastasized at an earlier stage. Now, the samples in the tissue bank are all from random people that come into hospital with cancer and they get operated on. As far as we know, none of them were actually treated or took any vitamin C extra on top of what your normal diet would be. So our question is, can we actually improve on this? Can we get more vitamin C into the tumor? And for that, we've done a small window study last year here in Christchurch Hospital, where we approached people that came in to have the analysis done, the test done, whether they have bowel cancer, which is called a colonoscopy, and I'll tell you a bit more about that. So at that point, we asked permission to have a small part of the cancer that was taken at that point for testing. Then, if they had cancer and they signed up and they consented to the full study, for 4 days prior to their planned surgery, they got daily infusions of very high doses of vitamin C into their vein. And this is a picture here of one of our lovely volunteers who sat there for 4 days having vitamin C injected into their veins. And then at surgery, we got a tumor sample to analyze as well. We also analyzed blood levels throughout, but I'm not going to show that data. The important thing is throughout here, we had no serious effects, even though these patients really got very high doses, up to about 70 grams of vitamin C per day. So what's a colonoscopy? So this is a schematic here of what your colon might look like. It's not as prettily colored, I'm afraid. And the way that a physician would look for cancer is they insert a bendable tube into it, and at the end of that tube is a little camera, so it's like a video taken from the inside of your bowel. And at the end of that flexible tube is also like a pair of pincers, and that can grab a tiny little piece of what looks like a cancer, and this is what the physician would see. Take a little piece, take it out, and we immediately freeze it down for our analysis, and they take a piece for diagnosis and see whether this is a cancer or whether it's just a polyp. Then at surgery, usually quite a big chunk of the colon, of the bowel, is removed, and that includes the tumor. So this is the tube of the colon cut open, and it's now open like this. So we can see around here what the normal mucosa, the normal lining of the bowel looks like, and then in here is this aggressive-looking tumor. Now, the important thing with what we could do in the small clinical trial, because we were working so closely together with the surgeons and the tissue bank and everybody, we could actually get samples of this tumor, not just anywhere, but we could sample it from the rim inwards towards the center where there's less vasculature in the tumor in the middle. So what did we find? So this is again color-coded so that it's a little bit easier to understand. And I've used the same picture, the same photo that I've used then in order to try and explain what we were able to measure in these different patients. So we had a cohort of patients that were infused with vitamin C every day, but we also had a control cohort which did not get the infusion, so we can compare them. So this was the biopsy. This was at colonoscopy. And with the color coding here, you can see that the normal tissue has slightly higher levels of vitamin C than the tumor, but they're both within the sort of medium to low range of vitamin C when we measured them. Now, at surgery, as I said, we could sample throughout the tumor, and we could see not only that the rim was, pretty low, but towards the center we had even less vitamin C. So it's likely that the vasculature has a role to play in order to deliver the vitamin C. So in the center of this tumor, we have extremely low levels of vitamin C, and that is probably not a good thing, because at that point you have the HIF, the master regulator, out of control. So what happens when we look at the patients that were infused? Now, the cohort as a whole were reasonably similar in the vitamin C at the colonoscopy stage. So we had medium to low levels of vitamin C, both in the normal tissue and the little biopsy that we could take. But after they've had the vitamin C infusion for 4 days, as you can see, the whole picture turns green. So vitamin C was effectively delivered to not only the normal tissue, but very effectively to the tumor as well. We still seem to have this grading throughout the tumor, but nothing stays in the medium to low vitamin C range. We are still now analyzing what actually happens to the master regulator in these samples, so the analysis is ongoing. So the take-home message from me is that it appears that many healthy adults and cancer patients do not consume enough vitamin C in their diet. And when we measured it, many cancer patients had very low vitamin C levels in their blood, so they should increase really the amount that they eat. We could show in the samples from the tissue bank that if we have increased levels of vitamin C in the tumor, it is associated with a less aggressive type of tumor, and that we can use high-dose vitamin C infusion to increase the levels of vitamin C in the tumor. Now, that's the first time that has been measured anywhere in the world, so that's a world first. But there's still a lot of questions that remain, and I by no means advocate you going out and having high-dose vitamin C infusions at this point, because we don't actually know what it does yet. We just know it actually gets to the target. So coming back to whether vitamin C is snake oil, I think as far as cancer goes, it is not a snake oil. It is an essential vitamin. But how much we need to take and how often and in what degree, we can't really answer that question as yet. But it's a good thing to have in your diet for sure. And I'd just like to acknowledge my co-workers here at the hospital and in the school and all our funding bodies. Thank you.